Hi, I'm Dr. Carolina Jimenez. I'm a licensed psychologist with a private practice in Houston, Texas, and I also serve anyone in the state of Texas via online therapy. Today I want to talk to you about immigration evaluations. I work with 4 different cases, including asylum, extreme hardship, U visas, and VAWA, and I will explain what each of those means in future videos. Today I'm going to focus on asylum. First of all, you can always consult an attorney or a nonprofit organization who works with immigrants. Here in Houston, we have several organizations, including Catholic Charities, the Houston Immigration Collaborative, and some churches who help immigrants. So first, talk to an attorney or to a nonprofit organization to learn if your case qualifies for asylum. Asylum refers to protections given to immigrants who flee their home country due to persecution. So this could be because they're members of protected groups. This includes being a woman, political affiliation, religious beliefs, and sometimes physical or intellectual disabilities. So people are persecuted, harassed, and in many times physically assaulted, emotionally abused for being a member of a specific group. So people will come to the United States seeking asylum. Oftentimes they are referred to psychologists, and we do a psychological evaluation. The purpose of the evaluation is to show how that trauma or that harassment and persecution they survive in their country of origin could still be impacting them today. So we talked about their background, the circumstances leading to them fleeing their country, why they believe they're still not safe if they were to go back. We talk about the physical, emotional, psychological, and social impact that the persecution has had on them. It's also important to talk about their background because oftentimes there are several factors that could be combined to make it more difficult for someone to adjust to life after persecution. So what you can expect is to complete an evaluation. We'll ask you basic demographic information, your age, when you came to the United States, your family history, family of origin, medical history, trauma history, as much information as we can collect regarding your background, because this gives a picture of your overall life, and we can focus on specific factors that could be protecting you or placing you at risk in the present. We also talked about any symptoms you might be having. For example, when someone survives a traumatic experience, they might not develop symptoms right away, but oftentimes they could develop post-traumatic stress disorder. So we assess for that. If it applies to your case, you might be given a psychological diagnosis. Keep in mind not everyone has one, and we do have to follow certain rules for the symptoms, how they impact you, and whether or not a diagnosis could be given to you. After that, we'll write you a full comprehensive evaluation, and that is used as part of your evidence for your case. So you'll have a document that states the type of trauma you experience and how it's still currently impacting you in your life. For more information, feel free to follow me on Facebook as Jimenez Counseling and on Instagram as Dr. Carolina Jimenez. If you have any more questions, you can call me at 281-709-2933. And I will be posting more information about the other cases in the future. Thank you.